The future of healthcare, and for that we have B.S. Ajaikumar, Chairman and Chief Executive Officer of Healthcare Global Enterprises.
It's good morning, still morning. You've heard about the opportunities in India in terms of various different divisions, including we always talk about technology, other aspects, infrastructure. When it comes to healthcare, when we look at India and what is the future, what comes to mind for an ordinary investor is it is not fully organized. What are the real opportunities present and future? How transformation in healthcare has happened and what can happen in the future? So what I would like to do is in the next few minutes take you on a journey to show what exists in healthcare in India. In my own experience, how transformation can happen and what are the potential opportunities as well as need for healthcare in India. So when we look at this, how do you measure, when you compare to the advanced countries, when you really look at it, a country can be called advanced when it takes care of the health and education needs of its people. So how does India address this? And how we can learn from what has happened in other countries. I myself have practiced here for a long time. And we know very well what has been the issues in this country with the healthcare system, the cost. We always talk about that. The insurance system. Then when we look at a country like England, the NHS system, is it really working or not? So what are the lessons India can learn now at a starting phase? Can we go the right way by this? And in the process, provide immense opportunity for private enterprise. One of the good things about India is it is heavily loaded in favor of private enterprise when it comes to particularly tertiary care. Today, 70% of tertiary care is provided by private. So one can look upon it as an immense opportunity, particularly when you consider India, as most of you know, as multiple countries within a country. We have India, which is very affluent and which is middle class. By some quoted figures, over 350 million or so. But it is hard to measure because of various other issues. It could be even more than that. Then we have the other 800 to 900 million population, which are on the weaker section, which someday are going to demand higher care as they come into the mainstream. So that is the future of healthcare in India when you really look at it. So the scenario is different Indias within India, and that itself providing an opportunity. So when you look at this, you have the system of how the healthcare spending happens. Of the 75 billion, of which nearly 55 billion is borne directly by the patient and their families. So clearly showing that the individual who pays. Now the question comes up here, is there something wrong in this? As we know very well, based on various studies, question is whether the individual should pay for their health care, like they pay for their real estate, or should it be borne by the government? Or it should be a hybrid variety where both the parties participate. Actually, that is what is beginning to evolve even in the developed countries where both the parties are participating. So in India, the good thing is the consumer, if you call the patient the consumer, is the king. And they demand good quality healthcare. And that has driven the good quality healthcare in big cities. How do you measure the good quality healthcare? Obviously, when the patient comes to the hospital, good quality is measured by what is the outcome results, what is the mortality, what is the morbidity. That is how you measure the quality. So can we have that parameter in India using the basics of patient being the major payer and develop a system around it where India could be one of the leaders in this field in terms of how healthcare can be effectively managed without causing unnecessary burden to the system. So when you look at the slide here, I think these are all slides are far away from me, but anyway, when you look at it here, India as healthcare spending is very low even by developing country standards. So and again you look here, the public and private is much more than public, even compared to Brazil, Russia and all, the spending is far less. So it gives actually an opportunity to develop a proper system. And again, per capita healthcare again is very low in India compared to even China or Russia, as you can see here. So what does that mean? It means that there is actually a country where there is younger population. Because of this, what we are looking at in the future is obviously the younger will become older someday, maybe sooner than we think. And lifestyle changes are taking place in India tremendously. As an oncologist, just to give you an example, when we look at big cities, it is following the West. For example, breast cancer, colon cancer, prostate cancer are rapidly increasing in big cities, whereas diseases such as cervix or head and neck are decreasing in big cities. So this is the trend which is going to follow as people become more affluent. So cancer actually and heart disease, as we know, are all lifestyle diseases, and India is going to be the world capital of diabetes, unfortunately. So these are all the things which affluence is going to do to India, and again one can look upon it as a need and an opportunity as we go forward. So here is a slide showing how the spending, the GDP has increased, and it now per capita is going to increase more as we go forward. India is already catching up with China, and it is going to keep increasing rapidly as we go forward. The another thing which is going to happen in India, the cost is going to increase. As we see here, the medical staff average is increasing even though it is a low base. And as we catch up here, obviously the cost of performing the procedure or healthcare itself is likely to go up. So in this scenario, what is going to happen here is the expenditure from the personal side obviously is quite large compared to what the government or the system is paying in India. Now, when you look at this, which is quite high, the expenditure, and then when you look at what is the role the government can play, an important discussion is taking place in India today in terms of the role of the government and the role of public, the private enterprise. Government all along has been the provider, to some extent payee also in the past. And now when you look at UK there, UK is mostly a provider and a payee also, whereas United States is mostly a payee. It does not provide that much. So India is like a hybrid now where both are happening, but we believe it is moving more towards a payee system rather than a provider. So what that means is the government will monitor the system going forward and make sure quality is provided care and try to bring in universal health care, particularly for the below poverty line. So this will obviously open an enormous opportunity for private enterprise to penetrate not only the big cities, but most importantly tier 2 and tier 3 cities. That is where the opportunity exists in Indian healthcare system, when enormous amount of population, nearly 900 million plus, will be demanding high quality care, and most of them being in semi-urban or rural area, where government is going to be a payee, and in turn incentivize the private enterprise to enter this market. Today, unfortunately, I think, I have another slide here. This is again showing the pay thing. Today, what is happening is out of pocket now will move towards third party payer, government as provider moving towards government as payee, and what is going to happen is there will be institutionalization. And how do you measure this? Like I said, rather than being individual physician driven, India is known, some of you have experienced it, is a mom and pop nursing homes, hospitals, where most of the work is done because of the name, family name. Now it is going to be driven by institutions, outcome driven, and empowered patient. One of the important thing in India is today, India being a IT hub for several IT companies, the people are very much tuned to IT, and they do their own research, for example, in big cities to come. So actually, the big difference in India is people are well educated, particularly the middle class, and before they come to the doctor. One of the analogies I like to give here is recently I met a professor from an art institute, and I was having a lunch with him, and I asked him, he's going to the hospital. He said, why are you going? He said, some colon problem. Do you know what it is? No, my insurance company is taking care of everything. So they, sadly enough, maybe they are not deeply involved. It turns out he had cancer. So whereas in India, it's the other way around, where people are definitely involved, not only in what's going on, but also the cost. And this is what has driven today, good or bad, that India is the cheapest healthcare provider in the world. When you compare, I'll show you a study done by HBS, where we are nearly less than 1/9 the cost, and even by Africa, we are 1/3 the cost in India compared to East African countries. Well, while this has driven the cost down, I think the challenge for us is to obviously make sure the quality is the same. The cost can be low, but really is the quality the same? Is it a measurable quality? Can it meet the global standards which have already been set in various diseases? That is a challenge. So while there is a large gap of supply in many ways, healthcare delivery is highly localized. This is an important slide to know that we always hear in conferences, there is per bed requirement so much in India. There is underserved, so many doctors are required in India. But is it really true on a pan-India basis? When you look at this, you will understand not so. When you look at cities such as Bangalore, Hyderabad, Delhi, or Mumbai, they are oversaturated. We have more beds than required by any international standards. We have more doctors there than any international standards. We have more technology there than required. So it is really concentrated in few cities. And why is this happened? It is because private enterprise has gone there in a very unorganized way, and they are learning their own lessons. But like I said before, while this is heavily organized in big cities, there is immense opportunity in other cities which are quite big by any very Western standards. When you look at, for example, New Delhi, which is a population of 12 million or 18 million by some standards, Bangalore of 9 million, you go to cities which are 3 or 4 million, which don't have any health care. And this is where the future demand will come for healthcare in India. And this is where the people will demand high quality of care as they become more educated and savvy. And this is where I think the opportunity exists for healthcare in the future in India, where, as we know very well, people would not like to travel distances. If they want tertiary care, people would prefer, like any part of the world, to get the care near their own home. Traveling itself by any standards is quite expensive, and staying away from home. So when you look at this demographic as it unfolds, it is very clear the opportunity for future in healthcare, be it any form of tertiary care or management of diseases such as diabetes, cancer, cardiac care, neurosurgical cases, all of them now going forward will exist in cities which are not 8 or 10 million population, but which may be 5 million or less population. That is where the opportunity will be going forward. And this again showing demand and supply hospital beds in major hospitals in metros, clearly showing the number of beds we have in big cities like Chennai, Bangalore, Hyderabad, Delhi, Kolkata, and Mumbai are more than what is required. However, tier 2, tier 3 cities will need much many more beds. So just to conclude here again, that government is playing an important role, and this role will actually increase as we go forward. And this again, they become a payee which could be beneficial in the long run for moving into the tier 2, tier 3 cities. There are a number of innovations which have happened in private enterprise, where cardiac surgeries at a low cost, eye surgeries are known for that at a low cost, replacement and cancer care at affordable and accessible across India. These have made a paradigm shift already in India, where high quality of care may be near their own hometown. This is what we can take it forward. When you look at the outcomes, for example, in cancer care, the own institution, clearly showing $2,900 for breast cancer treatment, $22,000 in US, with pretty much the same outcome of 86.9 versus 89, statistically insignificant, clearly showing one can achieve quality at a lower cost. And this is the model I think can be taken forward and create opportunities as we move forward. What should be the role of government? As we know very well, infant mortality, maternal mortality are still major issues. In fact, there was a recent article in New York Times clearly showing the open defecation, 600 million, which is causing infection and mental retardation in India, as well as stunting growth. Government should focus on these and encourage the private enterprise to penetrate the market for tertiary care. This would provide a total answer for primary, secondary, as well as tertiary care going forward, since there is a strong private enterprise in India. So this is how I think we can get the objective of providing healthcare to all in terms of primary, secondary, as well as tertiary care. It is a model which I think a sustainable model, where government plays its role for primary care and private enterprise takes on the tertiary care. Governments becomes a monitoring agency, and this can be the model which I think going forward is sustainable. Thank you very much. And I think, I don't know if you have time for any questions. Yeah.
If anybody has one question.
Dr. Ajaikumar, how can investors, either foreign or domestic, profit or benefit from Indian healthcare?
I think the investors should recognize mainly through what I believe is the opportunities in tertiary healthcare, where identifying the entrepreneurs, that is what we are also trying to do, even though I have done the cancer care, and encourage them to use their vision and see how we can partner with them with their vision to develop a solid healthcare for going forward. And this is how I think investors can benefit. And what has been done in cardiology, oncology, and other fields has been quite remarkable in healthcare, apart from pharmacy. As you all know, you heard earlier how pharma has really taken off in India. I did not touch on that. But I think the investors can benefit by looking at orthopedics, for example. These are all immense opportunities across India. The only challenge for the investor is to identifying the entrepreneur or group of entrepreneurs who will do. And I think the mistake may be identifying business people and being partners. That has been somewhat of a failure in India, as you see how it has happened. But entrepreneurs with a vision would be a good bet for investors. Okay. Thank you very much.